We would like to acknowledge that the following presentation was held on the unceded and traditional territories of the Algonquin people, where both our Indigenous friends as well as non-Indigenous friends gathered together at Parliament Hill to help bring awareness to those impacted by FASD on October 20th. We thank all who joined us in helping those impacted by this disability.
Right now we have 22 of our lived experience members here in the room with you. We certainly hope that you have the opportunity to move around and meet with all of us during this time. We also want to acknowledge our collaborating partner CanFAS, who I was waiting to see if someone was going to hop up. I don't see that happening right now. So we do want to very much thank them. They have been just instrumental in helping us move along in terms of our own organization. I see a smiling face there, excellent. And we also want at this point, I do know that MP Barron is needing to go here shortly, and I know that Senator Ravalea is also needing to go here shortly. So I think, Scott, did you want to come up first?
We're discussing who to go in order.
Okay.
Totally fine.
Scott, all right, right here. So obviously, yeah. Okay, so obviously the other instrumental folk in terms of making this day happen, our sponsoring MP, Scott Reed, has been, I'm trying to delicately say the fact that Scott reached out to us 2 years ago, and I don't know if you really appreciate the significance that it had for our group, but we were having a picnic that we do on an annual basis, and Scott sent greetings along and shared some information with us that Scott gets it, and I'm just going to leave it at that.
Yeah.
So, Scott, I invite you to come on up. Thank you very much.
Well, I think what is being referred to here is this. A couple members of my family have fetal alcohol effect, I think would be the right way of putting it, although with something that produces such a wide variety of syndromes, it can be hard to tell what the right way to apply is. But my sister-in-law is legally blind as a result of fetal alcohol effect, and brilliant woman, by the way. She lives down in Boston and is a therapist who deals with crisis situations. So she has literally talked to people over the phone when they call in out of suicide, that sort of thing. Extraordinary woman, but legally blind. And my brother-in-law has a totally different set of symptoms, but obviously alcohol consumption during pregnancy was the source of it. In his case, there's an issue with impulse control, and frankly that has done more damage to his life than has done to her life. But of course they're typical, and by no means suffering as badly as many others are suffering. It's something that affects an individual can affect their whole family. So the damage that can be done by FASD goes way beyond the individuals who are affected directly, because they manifest the physical symptoms. And we've got to care for these folks. You know, I'm mentioning two people who among the many thousands have been affected, but they are just as beautiful and precious as everybody else. And from the moment they're children, to the moment they become adults, to the moment they move out to the world and beyond, it is all the same respect and love as anybody else, and all the understanding that's needed. So that's one thought I had. And the second thought I wanted to have is regarding rural areas. We were just discussing this a bit earlier. Rural areas, it's just a function, as an MP represents a rural area, have represented Lanark, Frontenac, Kingston now for 22 years. I can just say that it's just a function of people being spread out thinly, that there are many things, it's just harder to provide services. And so rural areas tend to be behind on many things. Response speeds for 911 services, for example, as an example. People are concentrated in an area, you can get to them with, say, a defibrillator that much faster. But also other services that are both health-related and as a rural person, I can tell you my frustrations with cell phone service in our rural area. And my staff, several of whom are here, I just saw Sandra come in, they're all familiar. Sandra's familiar with the calls I'm having with her when I'm on the car and your call gets dropped. So there's all of that stuff. But it means you need to take extra time and attention to focus in and put in the resources. And because, so there was a time when that was a problem, but we were primarily a rural country 100 years ago. And so attention got paid. Now we're primarily an urban country in terms of where our population is. And whether it's federal politics, provincial politics, the tendency is to kind of forget about the rural areas. I don't want to exaggerate that. It's not intentional. That just kind of happens. And this means with everything, including with taking care of people who are either experiencing a lifetime of dealing with FASD syndromes themselves or helping others who they love with FASD, it's always that much harder in rural areas. So reaching out and creating this organization, helping these people is an extraordinary effort, an extraordinarily needed effort. I'm really, really glad that somebody thought to do it and that all of you have thought to do what you can to support and help. And so I'm just speaking on behalf, although I wasn't authorized to do so, of all those people out there who are either suffering from or helping with FASD and fetal alcohol effect. Thank you for all the amazing work that you are doing, and I anticipate that you will continue to do. Thank you.
Colleagues and families and caregivers and service providers, researchers, Rural FASD Support Network and Canada FASD, and thanks for the invitation to come and be with you for a short time today. I also want to acknowledge my colleague Lisa Marie Barron, MP as well, also from the west side of the country, and very pleased that you're here with us as well. So I am the Member of Parliament for the Yukon, and honored to co-sponsor this reception today for really a number of reasons. And I do come from, of course, a northern and mostly rural riding, and I've also been for many years familiar with the work of our local organization, FASD, which is the Fetal Alcohol Syndrome Society of the Yukon, in their vision for better community resources, for well-documented reporting of FASD, and their commitment to a strong action plan with the potential to make a difference in the lives of Yukoners with FASD. And another reason is my background is actually in public health. So I was the Yukon's Chief Medical Officer of Health before I entered this other world a year ago in 2021. And so from my experience in the medical field, I know that access to diagnosis and the right support can certainly boost and help individuals with FASD really live full and active lives as we see here today. So, and as a public health practitioner in particular, I have kind of an ingrained passion for prevention and for justice and for equity. FASD is first and foremost a lifelong health concern, and it's a collection of disabilities that affect all body systems, but also touches people across socioeconomic, gender, and ethnic categories, including what's important for us in the Yukon is Indigenous populations, because we have a 25% Indigenous population. So by learning from organizations such as Yukon's FASD, and I have learned very much from their expertise and their advocacy, we know that early diagnosis, support, and interventions make a dramatic difference in the lives of affected individuals, enabling them to be active and positive participants in society. So what can we be doing better to support people living with FASD? What should we do better? I'm sure that no matter what the answer is, there's more there's more that we can do, and that's why I think from gathering today and sharing experiences, sharing some of the expertise that each of you brings and life experience, these gatherings are so important. As far as FASD and Indigenous people, the Truth and Reconciliation Commission's final report included 2 calls to action, number 33 and 34, that made specific recommendations around FASD. Culturally appropriate preventive programs and reforms to the criminal justice system to better address the needs of offenders with FASD. So as MP, one of my main priorities coming into my campaign, in fact, was advancing reconciliation with Métis, Inuit, and First Nation people across Canada, including the 14 First Nations that called the Yukon home long before we settlers did. In response, so certainly from the federal government side, since 2017, our government has made annual and ongoing investments of over $14 million through Indigenous Services Canada's fetal alcohol spectrum disorder program for prevention and to improve the quality of life of those affected with the disorder. And as of 2022, this amount has increased to $17.9 million to expand mentoring and community coordinator projects. Justice Canada, on their part, continues discussions with federal, provincial, and territorial counterparts regarding sentencing-related issues and has published 3 reports to address knowledge gaps in the area of FASD and criminal justice. Bill C-5 is currently before the Senate as another step in I think, a really positive direction. And this bill will address sentencing policies that have contributed to the overrepresentation of marginalized people, including those with FASD, in the justice system. And finally, in discussion with colleagues and constituents and in the literature, we know we need greater awareness. Despite its prevalence, and I know that CAN FASD has published the 4% prevalence that FASD, so surprising prevalence to those who have perhaps not heard that statistic. Despite its prevalence, FASD is not well known and certainly not as well understood as other disabilities, even neurodevelopmental disabilities. So we need better research and reporting. We need improved information. We need improved sharing of information on demographics, diagnosis rates, subscription to support programs to then better inform resource allocation. And I know that CAN FASD is calling for a national FASD strategy. And whether we get there or not, we do need coordinated policies to ensure that we're following best practices in prevention. And I just met Kevin there from Lanark County Planet Youth. I'd encourage you to visit him if you don't know him already. An example of an amazing prevention program called Planet Youth, emulating the Iceland experience in reducing addiction rates and substance use rates from the highest in Europe to the lowest over a 20-year period. So we need to emulate what the best practices are in prevention, and we need to support affected individuals to live active, productive, satisfying lives, as should be the right of every Canadian. So I want to thank Rural FASD Support Network and CAN FASD for bringing awareness to Canadians living with FASD and their valuable work as advocates and support to providers and to people affected. So it's really encouraging to see you all out today. I look forward to continued progress towards a national strategy for FASD prevention and support. So thank you very much for
Thank you so much, Scott, for that. We would like to invite MP Barron at this point to come up and share a few remarks.
A little shorter. Thank you, everybody. I'm so happy to be here on the traditional territories of the Algonquin Anishinaabe people. And first and foremost, I just want to express my gratitude for each and every one of you being here today. It's been heartwarming to meet with you and to hear the personal stories, to hear the work that all of these organizations are doing, what inspired so many of you to get involved in this work. It's been really eye-opening for me. I want to acknowledge the particular organizations, but I want to make sure I'm not missing anybody. But of course, FASD, Rural, FASD, FASD1, and then the Asante Center. And I'm wondering, is there anybody else that I'm missing that I didn't acknowledge? I don't think so.
The Anishinaabe Husky Nation is here as well.
Thank you so much. I definitely don't want to miss that one. So thank you all for all of your work, for being here. Also, thank you to the other members of Parliament who are here today, support workers. There's just a wealth of experience and reasons why people are here today. And this is exactly what we need to see. We need to see people coming together, of all different backgrounds, different organizations, different political parties coming together to do this work, to ensure that FASD is getting the attention that it deserves and the supports that it requires for us to be able to move forward in a strong direction. My work prior to becoming a member of Parliament, I'm newly elected. I don't know how long I can continue saying that for. It's been about a year now, so I'm still going to go with it for a little bit longer, but I've been elected for a year. My work prior to having the honor and privilege to be in this position was in mental health and addictions and around the symptoms of poverty. And I will say my work frontline and my work in the communities, seeing the lack of leadership at the federal level and how that trickled down to community members, to organizations, really was my inspiration to run at the federal level. And now I'm here and seeing all the work that's happening across Canada around FASD awareness and supports, and it's reignited my desire to push, because I'm a NDP, of course, deputy critic for mental health and addiction, so to push the government to put in place that federal leadership that we need to move forward. We know also, seeing my work on the ground, there is still stigmatization out there that is impacting and creating barriers that are unnecessary for access to vital services. And so I'm just so pleased to see everybody coming together like this, because this is the work that will move us in the right direction to destigmatize FASD, to ensure people are getting the supports that they need, and to pressure the federal government to instill federal leadership. I just heard as well that there is a bill that's being put forward at the Senate, which is very exciting, around FASD, and my hope is that we can see that good work being done as well in the House of Commons, and see that push happening at all levels to get a national FASD strategy put into place. I wanted to tell you while we are here about a motion that I have put forward. It's M61, not that the number matters, but that's what it's called. And I am pushing for a national alcohol labeling strategy. And the reason is behind that is because education and awareness is just one component of the work that needs to happen here. But I am pushing for us to have the labels put on alcoholic beverages. We know that alcohol is a class 1 carcinogen linked to many types of cancer, breast cancer, gastrointestinal, head, neck. There's multiple cancers that are linked. And also all of the other economic and social costs of alcohol consumption. Now, my my desire is not to place judgment on alcohol consumption, but to ensure that Canadians have the information that they need and deserve to be able to make the best decisions for them. And that's what I'm pushing for, is that we're going to have in place labeling that will ensure Canadians have access to that information, and we're not leaving it with large corporations who are worried about their bottom line to decide what information Canadians deserve. And this is all interconnected with the work that we're doing today. Prevention and education is one component, but of course all of the social determinants of health, wraparound services, the a community of support around each of us, both through pregnancy and into each one of our lives throughout our livelihoods. We need to have all of these pieces in place to ensure that we're moving in the right direction. And I think that's why my desire to push for this national strategy is so important, because it'll take all of your voices and implement it into a strategy at the federal level that'll make everybody's lives easier. But overall, I just wanted to say thank you to each of you for being here, for all of the work that you're doing. My heart is full, and I do hope that we stay in touch moving forward as this work continues, so that we can, as a collective, ensure that the pressure is continuing, that the momentum continues to build, and people with FASD get the supports that they need, and their loved ones and families as well. So thank you so much.
Next, we would like to invite Senator Ravalia to come to the front. I have been told by a little birdie that we might have a major announcement coming here, so we certainly, from our members in the rural FASD, we look forward to hearing what you have to share.
Still good morning. Good morning, everyone. It's a pleasure to be here, and I'll just begin by introducing my colleagues, Senator Pat Duncan and Senator Michelle Audette, who are working very closely with me in advancing our partnership with all of you. I think what I've come to realize this week is that we've become a family, and if we work together, then we can continue to advance a very, very important cause. For me, this is particularly motivating and moving because for the time that I was not a senator, I worked for over 30 years in a rural community in Newfoundland and Labrador. And I quickly realized during my practice years that there were huge gaps, that the medical community, the healthcare community broadly has failed our community, the FASD community. And we have an opportunity now to work together, to work collaboratively, to ensure that we're able to bring to the table not only the importance of many of the issues that have already been raised, but an opportunity to create a national strategy so that everyone gets a fair chance to live their lives to their fullest potentials. And having met some of you today has been particularly touching for me. I think it's important that I recognize my Director of Parliamentary Affairs, Sarah Parlowan, and Lars Anderson. If you just want to both raise your hands, please join me in thanking these two individuals who Sarah and Lars have put in hours and hours of work to ensure that we could yesterday have the honor and the privilege of introducing Bill S235, an act respecting a national framework for fetal alcohol spectrum disorder. Some of you were in the Senate chamber when we had the privilege, and I know it was particularly moving for the three of us who will continue to be your champions, your advocates as we move this through. I'm delighted that we have members of Parliament who are here today as well, and I sincerely hope that I can work closely with both of you as we channel this through the House. I think the importance of this bill is that it will create national awareness, which is critical, but it will also help to reach those communities in our country that are historically marginalized, the rural, the remote, the northern, and individuals in certain demographics who historically have not have had the opportunity to access the healthcare system. Having a robust national framework, as you would all agree with me, is long overdue, and I hope that this bill is one step in the right for all Canadians to receive equitable, culturally appropriate, and comprehensive care. So I thank you very much for being here, and I hope that we can continue to meet on a regular basis, continue this dialogue, and continue our conversations. Thank you very much.
Finally, I'm going to ask for Shelby to come up here and join me. Just a couple things. First of all, in terms of the Rural FASD Support Network, just as a means of a very quick introduction, we right now our organization was formed around, well, it was formed around my kitchen table 5 years ago, and there was 6 of us. And out of the 6 of us, we have managed to grow to the point where we are now representing 176 families from across the province of Ontario. And with that, those 176 families, we are entirely a voice first and voice only organization. Our membership consists solely of individuals who are either directly impacted by FASD or directly impacted as a primary caregiver. And so we were extremely thrilled to have Shelby selected as Canada's first youth accessibility leader with FASD last year through ESDC. And through that work this year, we're going to ask you a couple things. The first one is, Shelby, earlier this year, you were creating a series of videos where you were kind of sharing with folks how FASD, how it impacts your physical health, how it impacts your ability to go to school, how it impacts your adaptive functioning, and so on. But one of the things you shared with me was you found that the hardest part of all of it was to see the expressions on your mom's face and your brother's face and on your friend Cassie's face when they were kind of sharing those stories. Can you explain to these folks why you found that so difficult?
I guess I really understand how it feels to go through what they're going through, and then them sharing their stories, knowing that I can relate to it is very emotional. As you guys didn't see outside of the video, I had a lot of trouble regulating, and I had mental breakdowns because I had to hold myself together for the videos to show everybody that I'm strong, but in reality, I'm not. Same with the people that you saw in the stories and the videos and stuff like that. It's hard for all of us, including the families impacted that have it or have kids that have it.
And we know we heard from our speakers earlier that right now there's 4% of Canadians, which works out to about 1.3 million Canadians are living with FASD. Obviously, we don't have 1.3 million Canadians in this room today. We have a few folks who are here, but we are also missing folks today, are we not? Your mom is not here today, is she?
No.
Can you share why your mom is not here today?
I'm guessing it was just really hard for her, and I don't think it would have been a good idea for her to see everybody that's impacted by it, because it's already bad enough going to the meetings Saturday and seeing all the other families that have trouble.
Yeah, it's definitely extremely difficult to get in front of this many folks. I know I'm really nervous right now. That's why I'm holding on to my hands so that they don't shake on me right now. And I can imagine you're feeling kind of the same thing. But we heard that there's the possibility of having a national strategy to support people with FASD. What would that mean, do you think, for Izzy and Annie and Rick and William and Jacob and Cassie and Skylar and Wayne and yourself? What do you think that would mean for all of you?
We have a better opportunity at life and a better opportunity with education, and we're treated the same as other people, because we're no different than other people. We just have to suffer and go through what our parents went through, and half the reason why we have FASD is intergenerational trauma, because there was no supports.
We've also heard today that there's the possibility that you and some of our other folks might have the opportunity to kind of share in the future what it's like to live with this disability. Would that be, if someone came to you and said, Shelby, are you up for that? Would you be willing to share those kinds of things?
Yeah.
Beautiful. Finally, we want to make sure that we also recognize, like I said, this as you look around the room, for our very, very first time to ever come to Parliament Hill, to ever do an event like this. We said before we even arrived here today that we had already met our objective. Our objective was to let Shelby and Wayne and Jacob and all of our folks know there is value in sharing your story. There is value in finding the courage to tell people this is what it's like. So I guess on behalf of the rest of us who are raising them to see they are our heroes, thank you so much for giving us an experience that we will be able to hold on to for the rest of our lives. So finally, we also want to introduce Dr. Bocking from FASD to come on up and share a few words as well.
Thank you so much, Shelby, and thank you very much, Rob, for organizing this. And so I'm Alan Bocking. I'm on the board of FASD, and I'm speaking on behalf of our board members. The chair of our board is here with us, Alicia Walker. And our executive director and other board members are actively involved in a number of meetings. So they want to be here. They may still get here, but they're not here yet. Kathy Unsworth is the managing director of FASD, and she's here as well. So on behalf of FASD, I'd just like to echo all the comments that have been made, to thank all of you for coming. Thank you so much, Shelby, for sharing with us your thoughts and contribution. And as the strategy moves forward, I know that will be an important voice to helping to frame that. And thank you very much to Senator Rivera. I had to leave, but Senator Duncan is here as well. And thank you to that Senate group that has introduced the bill. And we look forward as FASD to working with our colleagues on moving this forward, and then hopefully into the House as well. So that's just a few comments on behalf of FASD.
So, very quickly, Alan, it's great to meet you finally. We've crossed paths so many different times, but it's great to physically meet you finally, so thank you very much. Finally, we are also privileged to have MP Ferrari.
Close.
I did it. I did the car. I know. Ferrari. Thank you.
Same thing.
So I would invite the MP to please come forward and to share a few words as well.
No, it's okay. It's okay. Hi everyone, I'm Michelle Ferrari. Everybody loves to say Ferrari because it sounds cooler, so I'm cool with whatever you want to call me. I'm a member of Parliament for Peterborough Kawartha, and I'm also the shadow minister or critic for families, children, and social development. And when I heard about you guys coming to the Hill, FASD, I knew I wanted to come right away. My colleague Scott Reed invited us. In 2019, I did a video in Peterborough with Brooke Parcels, and Brooke shared her story of FASD, and it was my first time really learning about the magnitude of this condition and the people and the lives that are impacted by it. And I look around the room today and I listen to Shelby. I didn't get to come in here till later, so I may have missed some of it, but your point of starting at a kitchen table and now sitting here in Ottawa is exactly how things get done, and we don't know what we don't know. And for Shelby to have the courage and articulation to get up here and to communicate why her mother isn't here. As a mom, it's powerful, and to watch, I don't even know who you are, but your tears were felt by me as well. And I think all we ever want as parents is to ensure that our children have everything they need to be happy and well. And when we don't have the knowledge, the tools, or the resources to identify why our children are doing what they're doing, or why we are reacting the way we are reacting, we cannot help people. And so this is amazing that you have done this grassroots movement. It is now on the shoulders of parliamentarians to soldier forward and to ensure that this national framework is in place. When you look at these stats, and people do not know this, FASD is 4%, autism is 1.52%. I can guarantee you most Canadians do not know that, nor do they even know what FASD is. They may not even know that they have it or that it is a possibility. Every child in our school system with possibly a learning disability who doesn't know why they're behaving the way they are, doctors who don't know how to diagnose this, doctors who don't even know to look for it. You go into the prison systems, you don't know why people are the way they are because you don't even know what to look for. So a national framework is critical when we move forward in managing this, because if we don't know, we can't do anything about it. My favorite quote, and I will leave you with this, Mr. Rogers, love this man. Anything mentionable is manageable, and knowledge is power. And do not let FASD define who you are, because it is not who you are. It is one thing, and it will change the world if we can educate people about what it is and how it impacts our country. Thank you.
I will simply conclude with this. We are familiar with your video, and I'm going to share with you a story that you would not know, but the video that you created was shared through our network at the time that it was released. And in fact, it was one of the very large motivating factors for what started Shelby on our path here today. So again, thank you so much. I believe, unless someone puts their hand up, I think we have all of our speakers. Again, I want to make sure that I'm acknowledging CanFAS for their presence here today. We, as I said before, the partnership that has existed between our lived experience and their research-based evidence, best practices that they have been sharing with us for years has been, you've been our guiding light through everything. And when we think about the strategies that we share with our folks today, the sources are always coming from you folks. So we thank CanFASD for being here today. We also want to make sure that we are acknowledging our particular funding partners. Kevin, I'm going to get you to put your hand up from Open Doors, from Lanark Children and Youth. They are our organizational mentor, and so as a grassroots nonprofit corporation, we identified very early on, we don't really understand procedures, we don't really understand how things are supposed to be done. So having an organizational mentor who kind of guides us through all of those things it's been a wonderful partnership, and we certainly look forward to continuing as well. We do want to also acknowledge our other partner. I do see Dr. Carace, thank you. So Dr. Carace from the Royal Hospital is also here with us today, and again, wonderful partnerships in terms of being able to serve our folks that live in the counties of Lanark and Leeds Grenville. And then finally, to our new collaborating partners, the Anishinaabe Aski Nation. It was a extremely pleasant surprise to have you folks reach out to us and to want to be here, and we look forward to those conversations moving forward as well. And then finally, of course, to all of our parliamentarians and our senators who were with us here as well. We have, I believe, still lots of food in the back. Please don't make me all loaded in the back of the SUV. So otherwise, the caterer was very, very definite, though, that they need to be able to come in right at noon. So thank you very much, everyone, for this wonderful day.